Good afternoon. Am I audible clearly?
Yes, sir.
Shall we wait for 1 minute? Okay. Let them
Okay.
join. All. Okay. Uh, Naito, shall we continue now because it's running live? Okay.
It's your wish.
Oh, yes. In the previous class, we have discussed about what is transplantation and what is the definition of transplantation and what is graft and what are the types of grafts are there in transplantation technology. And also, we have discussed about uh, types of rejection, or the definition of graft rejection, and types of how many types of rejection, graft rejections are there. We have discussed in the earlier classes and previous classes. And we have also discussed about major transplantation antigens. Okay, that means histocompatible antigens. Okay, we can call it as histocompatibility antigens. Those are class 1 MHC molecules and class 2 MHC molecules. We have discussed about clearly discussed about these two things, and also we have discussed about laws of transplantation. And today, I would like to discuss about um, rejection. Okay, immunologic basics of basis of graft rejection. You can see page number 202. Uh, what are the immunologic basis of graft rejection? Okay. Before going to detail, uh, you must know about the laws. Uh, you must know about the previous things. That means matching donor and recipient involves prior assessment of histocompatibility before going to replace the organ of from the donor. Okay, the recipient must donor and recipient must do the histocompatibility assessment. Okay? Three important uh, pre-transplantation tests must be completed prior to transfer. Those are blood group matching, okay, also called blood typing, MSC matching, also known as tissue typing. You know about blood group matching. Uh, uh, Frequently, you must heard about these things. And MSC matching is that uh, donor and recipient histocompatibility molecules should be matched in this type of technique. And cross matching, the cross matching means the presence of any preformed antibodies against a potential donor allogens must also be evaluated in this recipient. Uh, the we generate antibodies against non-self received HLA proteins for a number of reasons. But transplant recipients who have received prior blood transfusions or allografts are especially like we possess them. This type of testing is called as cross matching and is the most important level of compatibility testing. And these are the main tests should be done before going to organ transplantation. And for coming to the uh, graft rejection, in the two steps, the graft rejection should be done. And the first set of rejection and second one is second set of rejection. In the first set of rejection, what happens that uh, eh, the it occurs about 10 to 10 days after the first grafting from allogenic donor, and especially it the sensitized T cells appear in the lymph node that drains in the site of the graft. Foreign antigens expressed on the grafted cells stimulates the T cells that mediate graft rejection. Especially in the first set of rejection, T cell sensitization will be take place. The immune cells like lymphocytes, neutrophils, monocytes, and other inflammatory cells infiltrate the graft in large number, leading to the vascular changes resulting in the thrombosis and eventually death of the graft. Okay, this is how the first set of the graft rejection taking place. Okay, there is a decreased vascularization. Okay, in if you see this diagram, um, in the first, normally what happens, autograft acceptance grafted epidermis. Okay, recipient uh, immune system accept this graft, and revascularization will be done after the grafting the tissue or organ after 3 to 7 days. Okay, up to 7 days, 3 to 7 days, revascularization in both recipient and grafted cell. Okay, a body acceptance allograft autograft acceptance will be done after this 7 to 10 days. Healing, okay, wound healing will be done after the 7. This is a normal step, a normal happening, normal phenomenon. After 12 to 14 days, complete resolution will be done. Totally revascularization process will be done, and up to 14 days, complete healing resolution will be done after 14 days. This is how the normal procedure of the normal acceptance. Okay, normal acceptance of the grafted epidermis. Okay, what happening in the first set of rejection? The first set of rejection will be taken place uh, up to 5 days, 5 to 6 days. What happening in this process? In this process, in the first set of rejection, okay, revascularization will be done after 3 to 7 days. This step is normal in the first set of rejection. After 10 days, what happened in between 7 to 10 days? Cellular infiltration, okay, will be happening after the grafting organ or epidermis. Cellular infiltration, the site where exactly graft will be done, at that site, entire immunological active cells will be infiltrate to that site. And what happening? Thrombosis and necrosis of the grafted area will be the result of 5 to 6 days. Okay. After 6 days, damaged blood vessels and necrosis of the tissue and the entire graft will be happening after the 5 to 6 days. And coming to the second set of rejection, because of the immune memory, because of the immune memory and specificity, allograft rejection and display specificity and memory. Because of the specificity and memory, second set of rejection will be done soon after the graft. Cellular infiltration will be same, will be the same as first set of rejection. And after 5 to 6 days, thrombosis and necrosis will be happening. Okay, and in the first set of rejection, there is no memory and specificity is there in the first set of rejection. Due to that, it's time taking the time between the thrombosis and necrosis and grafting time is longer than second set of rejection. In the first set of rejection, the memory and specificity will be developed. In the second set of the graft rejection will be the uh, sooner or faster reactions due to the specificity and memory. Cellular filtration, after the cellular infiltration, thrombosis and necrosis is a result after the 5 to 6 days. After the 5 to 6 days, entire graft tissue will be damaged. As a result, necrotic tissue is a result of the of end. It is how the first set of graft rejection and second set of graft rejection is taking place. Okay, and we have talked about uh, the types of rejection. Okay, graft rejections or transplant rejection. In that, hyperacute rejection, hyperacute rejection, chronic rejections are there due to the target graft tissue or our recipient uh, cells are Antibodies, formed antibodies or active T cells, this graft rejection will be taking place. Okay, hyperacute rejection is result after the uh, 1 hour to several minutes. Okay, due to the blood grouping. Okay, due to the blood grouping, if the blood grouping is not matched with the donor and the recipient, the hyperacute rejection will be the result. Okay, and chronic graft rejection is a result of the infiltration of the different types of cells, T cells, and different types of immunologically active cells infiltration. If you see the target cell, target means the graft. In this image, target means the graft. Okay, the graft rejection will be done in several pathways. If you see the A, sensitized T cell. Okay, due to the sensitized T cell of the recipient towards the graft. Okay, that is one of the pathway to reject the graft. Okay, whenever the sensitized T cell, a T cell will be sensitized after the acceptance after the graft, and this sensitized T cell get activated and proliferated, uh, and this is one of these cell mediated immunity, and activated TH cell get activated, proliferated memory as a memory cell and effector cell. Effector cell goes and binds with the TC cell or B cell, and this may leads to the further activation of the B cell and TC cell. And whenever the TC cell get activated, and this uh, may undergo the proliferation, this TC cell undergoes the proliferation, and this TC cell get divided into the memory cell and effector cell. Effector cell will release the um, cytolytic enzymes from granzymes. Okay, different types of enzymes are there, and due to those the cytolytic or plasma membrane lytic enzymes, the target tissue or graft will be damaged. This is one type of the pathway, sensitized T cell. This is a T cell or cell mediated cytotoxicity. Okay, if the T cell releases the immunologically active compounds, that is cytokinins, these cytokinins also indirectly damages the target cell. The activated T cell directly damages the T cell. Okay, sorry, graft cell. Activated or sensitized T cell directly uh, kill or damage the target cell. Okay, that means graft. That is the direct pathway. And the sensitized T cell releases some cytokinins. Okay, these also uh, play a key role in the graft rejection. This is the indirect pathway. Okay, and what happens? Interferon gamma releases from the sensitized T cell, and these interferon gamma goes and binds with these cytotoxic activated macrophages, activate the macrophage or natural killer cell. Activated macrophage engulfs the target tissue. That means the graft tissue or graft cell. Or activated natural killer cell directly kill the target tissue or graft tissue. So this is the indirect pathway. This is indirect pathway. What is the second pathway? Natural killer cell. Natural killer cell directly kill the target cell or graft cell. Okay, what is next step is that complex armed natural killer cell. Okay, whenever the recipient get the grafted tissue, that the grafted antigens, okay, antigens exposed to the recipient immune system. That means our recipient immune system releases the antibodies towards the target or grafted tissue or tissue antigen, and these antibodies goes and binds with the uh, target or grafted tissue surface antigen and make a complexes, antigen antibody complexes. Wherever the antigen antibody complexes are there, these complexes are recognized by the different types of immunologically active cells. Okay, that is the one signal. Okay, wherever the antigen antibody complexes are there, that is a calling signal, calling bell for the different types of uh, immunologically active cells. Okay, for example, wherever the antigen antibody is formed, the natural killer cells, okay, natural killer cells goes and binds with those complexes and cross link between these antigens with antibodies where and natural killer cells having the FC receptor for these antibodies. Okay, the natural killer cells and macrophages and different types of cells are having FC receptors on its surface for those antibodies, where exactly the antibodies goes and binds with the target cell. The FC side is empty. Okay, this empty side will be the signal calling signal for the different types of active cells, and this FC region uh, fulfilled by the natural killer cell FC receptor, and this natural killer cell goes and binds with the FC region of the antibody complex, antigen antibody complex, and furthermore, these a natural killer cell get activated and releases some uh, cytolytic enzymes and kill the target site, target tissue, and this is one of the pathway. And coming to the next, antibody dependent cellular cytotoxicity. This is one another uh, type of mode of pathway, okay, to kill the target, to reject the target tissue or graft. What is antibody dependent cellular cytotoxicity? This is one type of the hypersensitivity. The second type of hypersensitivity. Antibody goes and binds with the target tissue antigen. Okay, this is one of the absonization signal. It calls these different types of active cells, for example, natural killer cell, macrophage cell, okay, neutrophils, basophils, some etc. etc. Cells are having which are having the site or receptor for the FC region of the antibody. Okay, where exactly these antibodies binds to the antigen. Okay, this binding or this complex formation uh, is one of the signal, one of the calling signal for the different types of cells. I will show one image for you. This is the antibody dependent cell mediated cytotoxicity. This is how the target tissue or graft is damaged, is being damaged. Okay, in this image, the target cell means graft. Okay, a graft tissue or cell is uh, is having the receptors or antigens, okay, processed antigens in general. Whenever it get damaged, all the surface cell molecules get exposed to the other recipient cells, and these surface molecules are act as a antigen. Okay, those antigens are exposed to the recipient immune system. Okay, and these whenever these antigens are exposed to the immune system, our recipient immune system, it makes the sensitization of the different types of the cells. For example, our B cells are get activated and releases these particular antibodies, and these antibodies goes and binds with the target cell antigen. Okay, and whenever this complex has been formed, and this antigen antibody complex will be formed after the sensitization or recognition of the antigens, and FC region is empty, and different types of these cells are having FC receptors for this specialized antibody, and those cells are came to the site or infiltrate to the site, a target site, that means target tissue or graft, and attached to the FC region of the target cell. Okay, target cell complex, antigen antibody complex. And whenever these cells, for example, eosinophil and macrophage, okay, surface antigens, natural killer cells, and neutrophils, these all cells are having FC receptor for different types of antibodies. Okay, And these cells, this receptor, whenever this receptor connected or attached by the FC region, these cells are get activated. For example, if the eosinophil get activated after the attachment, the eosinophil releases the enzymes. Okay, degranulation of the eosinophil will be taking place after the activation, and these degranulated enzymes are poured on the surface of the target tissue. For example, hazardous, most dangerous enzymes, okay, porphyrin, okay, porphyrin and lytic enzymes, granzymes, etc., will be released on the surface of the target tissue. And for example, if the macrophage antibodies receptors or FC receptor is get connected with the uh, target tissue, this macrophage also get activated and releases the same certain types of the lytic enzymes, okay, and the tumor necrosis factor, and these factors also damage the target cells. Okay, this is how the antibody dependent, because the this is happen only uh, after antibody attachment to the target cell antigens. Antibody guides the target. Okay, antibody guides the targets. That's why the name antibody dependent. This is all the process is done after the attachment of the antibody. Say, non-specific cytotoxic cells are directed to specific target cells by binding to the FC region of the antibody bound to surface antigens on the target cells, that is the graft cell. Okay, various active pharmacologically substances are released on the are poured on the target side or target tissue. That means lytic enzymes, okay, and tumor necrosis factor, porphyrins, enzymes. The porphyrins is a very most dangerous enzymes which which is having the capacity to degrade the making a pore. It makes a pores on the target tissue. Okay, by making a pores on the target tissue, or it damages the plasma membrane. It makes a pores on the target tissue or side cell, and due to the pore formation on the plasma membrane, the plasma cell cyto organs, organelles, and plasma oozes the cell contents out from the pored cells. By this pore formation, the target cells will be damaged. Granzymes, what happening? What is the function of the function of the granzymes is that making a signaling to the to the apoptosis. It gives the it activates it activates the apoptotic pathway in the cell. Okay, it activates the apoptosis pathway, especially in the mitochondria. It activates the some molecules, apoptotic molecules, caspases. Okay, it activates the caspases, and after the activation of caspase, apoptosis of the cell will be happening. Okay, this is the most uh, happening pathway in the antibody-dependent cell-mediated cytotoxicity. And coming to the next pathway, that is the uh, phagocytosis. Okay, phagocytosis of opsonized target. Okay, different types of cells are there. Okay, macrophages and dendritic cells are different types of cells are phagocytosis cells, and these cells are phagocytes engulf the entire uh, target cell, okay, infected cell or graft cell. When when the antibody guides this cell, okay, antibodies always guide these cells and the different types of whenever the antibody attaches to the target site, the FC region, these macrophages or dendritic cells are having FC receptor for those antibodies. And whenever the antigen antibody complex is formed, this FC receptor goes and binds with the antibody. Then these macrophages and dendritic cells are get activated, and the phagocytosis will be done. Okay, by the engulfing the graft tissue, the graft will be rejected after the phagocytosis. Okay, next protein. Next platelet adherence. This is one of the another pathway. This is how the different types of pathways are get activated and leads to the graft rejection. One by one, we will see what happening in every pathway. This is a these are the steps. These are the steps in the graft rejection process. Immune mechanism. So this is the mechanism of graft rejection. How the graft rejection is taking place. In this process, there are two steps. Okay, in the two stages are there. The entire mechanism of graft rejection can be divided into two stages. One is that sensitization phase. Okay, first one is that sensitization phase, and second one is that effector phase. In the first stage, what happening in this host or recipient lymphocytes? Okay, recipient lymphocytes are exposed to sensitized antigens of the graft. Okay? Recipient lymphocytes. Recipient lymphocytes mean T cells. Okay, T cells, B cells are exposed, get exposed to the graft or donor uh, cells or and proliferates. Okay, get exposed, and after they get exposed to the those cells, or these cells are get activated, and cell mediated uh, cell mediated immunity will be taking place. What happening in this? This is the delayed type of hypersensitivity reaction. The same mechanism also taking place uh, in the graft rejection process. So what happening in the first set of stage, and in the first set of sensitization phase, the antigens presenting cells, okay, and macrophages and Langerhans cells recognizes the antigens on the surface of the graft cells. Okay, the infiltration of these cells to the site will be happening. After the infiltration, these cells recognizes the grafted tissue surface antigen. Okay, after the recognition, those antigens are presented by the macrophages and Langerhans cells, dendritic cells, and after the presence of the antigens, the T cells infiltration will be taking place to the site of the grafted tissue. After the T cell infiltration, the attachment of the T cell to the MSC molecule 2, okay, the uh, activation of the T cell will be happening. In the what happened first, the sensitization with the antigen, the attachment of the T cell receptor to the antigen gets sensitized. After the attachment, this T cell gets sensitized and proliferate into the two cells. Okay, and what is that? Memory cell and uh, effector cell. Okay, excuse me. Hello, hello, hello.
Nothing, sir.
Okay, Nammo. Any doubt?
No, no, sir.
Okay, okay. We are talking about the stages. Okay, first one is that sensitization stage in the graft rejection. What happening in this stage? Uh, Sensitization means a T cell. T cell sensitizes the antigens. After the sensitization, with the help of T cell receptors and MSC molecules get attached. Whenever the T cell receptor get attached with the MSC molecule, which is antigen presented by this molecule, and this attachment, this binding, facilitates the sensitization of the T cell, and especially after the attachment, this T cell releases some immunologically active molecules. Those are the cytokines, and from these cytokines, This self activation of the T cell will be happening. After the sensitization, this cell get proliferated into the memory cell and effector cell. The memory cell is the memory cell always. It is having the memory to the specific antigen. And what happening? What is about the what about the effector cell? This effector cell, TH cell, go and bind with the uh, different types of the cells. Okay, it having the capacity to bind with the C cell and B cell, sometimes macrophages also. Activated or effector T cell go and bind with the B cell and also having the capacity to bind with the TC cell, that is cytotoxic T lymphocyte cell, and also having the macrophages, attachment to the macrophages. In this picture, you can see clearly this is the macrophages. Yellow colored cell is the macrophage, and whenever this the binding between the macrophage or cytotoxic cell or B cell, and this sensitized T cell goes and binds with the uh, different types of cells. This facilitates the activation of the other cell. Okay, it facilitates the activation of the other cell like B cell, TC cell, or macrophage cell. If TH cell activates the TC cell, what is the consequences? The consequences of the TC cell activation is that releasing the uh, different types of the granzymes, okay, proteolytic enzymes. Uh, After the activation of the TC cell, the death of the destruction of the target cell will be happening. If the TH cell or if the sensitized TH cell activates the B cell, what are the consequences? B cell will also get activated by the signal from the T activated effector cell, and this B cell get activated and proliferated into the memory cell and plasma cell. Plasma cell will release the antibodies. After the releasing the antibodies, these antibodies goes and binds with the antigens on the target tissue, and this is the opsonization signal for the different types of the FC receptor cells. Okay, macrophages will be coming to the site and attracted towards the site. Natural killer cell attracted towards the site. Eosinophils attracted is towards site. Mast cells and different natural killing cells attracted the target site. Different types of different types of uh, uh, molecules also attracted towards the target tissue. All these cells coming together dissect the target graft. This is how the after the activation of the B cell from the signal by the TH cell. If the TH cell or effector TH cell activates the macrophages, what are the consequences? Activated macrophages goes and engulfs the target tissue, okay, target tissue, and thereby destruct the reject the graft. This is the by these two steps, graft rejection will be happening. First step is that sensitization phase. In this phase, all the TH cells and TC cells get sensitized by the graft tissue surface antigens or molecules. And in the second phase, activated or activated or sensitized TH cells goes and binds with the different types of cells, and activation of the different types of cell will be happening in the effector phase. If the TH cell activates the TC cell, it releases the cytolytic enzymes. If the TH cell activates the B cell, it releases the antibodies. If the TH cell activates the macrophages, it engulfs the graft tissue. This is how the sensitization and effector phases in the uh, graft rejection is taking place. Especially different types, as we have discussed in the earlier, different types of pathways are involved in this graft rejection. Effector phase, in the sensitization phase, the different types of cell, immunologically active cells get sensitized uh, in the first step, okay, first stage. What happening in the next stage? Those sensitized cell get activated and proliferated, and the consequences of the active immunologically ingredients through those behavior, the graft will be rejected from our from the recipient body, from the recipient tissue. Okay, this is the phenomena, and these are the two stages. In the first stage, all the immunological cells are sensitized due to the surface antigens present on the target or graft tissue. This is how the two steps are there in the this process. Okay, these are the steps. Okay, different type. This is phagocytosis. The pathways, one pathway. For example, we have discussed phagocytosis is the one of the pathway. Whenever the Th cell uh, sensitized, gets sensitized from the target tissue antigens, this Th cell uh, proliferated and activates the macrophage. If the macrophages are activated, this is the consequence. What happening uh, in this example? Bacterium is given, but you can apply this entire things to the graft also. Okay, uh, this is a complement system. Okay, in the what happening in the graft rejection, complement pathways also very important in this process. Complement proteins, especially C3A. Okay, this is these are the proteins. Okay, these are the proteins very play a important role in the graft rejection. That is uh, sorry, not this one, C3A only, C3A and C5A. These are the two important uh, proteins, okay, which are playing a key role in the graft rejection. What is the function of C3A? Whenever the antigen is present on the tissue, this C3A goes and binds with the different types of the antigens. For example, in this see this picture, C3A and C5A go and bind with the target tissue or grafted tissue. Okay, this is C3A molecules and C5A molecules are complement protein subunits. Okay, in the complement proteins, different types of complement system. Okay, different types of proteins are involved. Okay, these are the subunits of those proteins. Okay, C3A and C5A go and bind with the surface antigens, okay, surface of the grafted tissue, and this is the opsonization signal for the different types of cells. For example, macrophages are having these receptor. Okay, C3A receptor and C5A receptors are there on the different types of the cells. For example, if the C3A attracts the macrophages, what are the consequences? Chemotaxis. Okay, cytokines will be released, production, phagocytosis will be happening after the attachment of the macrophages to the C3A or C5A. If the basophils attracts it towards the C3A and C5A, basophils are having C3A molecule receptor and C5A molecule receptor. What is the consequence? Degranulation of the contents. Okay, degranulation of the contents after the attachment to the uh, basophils to the C3A receptor, C3A molecule. Okay, if the eosinophil goes and binds with the C3A molecules or C5A molecule, what are the consequences? Degranulation and chemotaxis. Chemotaxis also taking place. If the C5A or C3A molecule attracts the neutrophils, what are the consequences? Chemotaxis and oxidative burst of the different types of the granules will be taking place, and phagocytosis is also taking place. These are the different types of mechanisms to kill or to reject the grafted tissue. Okay, if the mast cell if the mast cell attracted towards the graft tissue by the taking signal from the C3A and C5A, what are the consequences? Degranulation or chemotaxis of the different antibodies. Okay, it calls the different types of the antibodies and different types of the active molecules, and degranulated molecules also are having the pharmacologically important properties, and it kills it also play a role in the graft rejection. So these are the this is one of the phenomena or very important proteins. What are they? Complement proteins, complement pathway proteins. Okay, these are the pathways. These are the pathways, active pathways to reject the grafted tissue. Okay, and after the attachment of the complement proteins to the target tissue, what are the immunologically active steps are taking place? Lysis of the tissue will be taking place after the attachment of the complement protein to the target tissue. Opsonization, opsonization of the target tissue will be the one of the consequences of the complement protein attachment, and activation of the infiltratory response. Okay, vaso extravasation of the our macrophages. Okay, monocytes extra, if the monocytes, we can call monocytes circulatory monocytes. If the monocytes uh, extravasated from the blood to the tissue, we can call it as macrophages. Okay, in the blood we can call it as monocyte. If the monocyte extravasated from the blood to the tissue site, we can call it as macrophages. Okay. The attachment of the complement protein to the target tissue, that in this particular situation, the graft, you can assume that graft. If the complement protein goes and binds with the graft, these are the consequences. Okay, lysis of the graft tissue will be happening, opsonization will be taking place, infiltration of the different types. The signal, if the complement protein goes and attach with the target tissue, this is one of the signal to attract the different types of active immunologically active cells to the towards the site, towards the grafted tissue. And what happening in the another situation? Clearance of immune complements also taking place. Okay, clearance. If the complement protein goes and binds with the target tissue, and it attracts the antibody, and antibody antigen complexes are formed. After the complex, the different types of the Fc receptor having cells goes and binds with the Fc receptor, and antibody antigen complexes will be removed. In that process also, graft rejection will be taking place. This is how the different pathways. These are the different pathways that are actively involved in the graft rejection. Okay, and this is the one of the activation methodology or mechanism, and these are the entire overview of effector mechanisms involved in the allograft. What we have discussed earlier, the different mechanisms. Okay, the different mechanisms to reject the graft. So the different mechanisms involved in the rejecting the graft. What are they? They are just for your reference. I am just recalling once again. Activated macrophage. Okay, activated macrophage due to the TH cell sensitization, and Engel lytic enzymes will be poured on the graft rejection, grafted tissue. This is one of the pathway, and uh, activated DTH. The TDTH means uh, delayed type of hypersensitivity. Delayed type of hypersensitivity. This is the fourth type of hypersensitivity. Okay. Uh, if it is there, I will show what is the fourth type of hypersensitivity. Okay. Fourth type of hypersensitivity, delayed delayed type of hypersensitivity. Yes. For your reference. Okay. I will show what exactly delayed type of hypersensitivity is that. This is delayed type of fourth type. In the fourth type, what happening? Activated are sensitized T cell. Okay. Furthermore, activating the different types of the cells, especially macrophages. Okay, activated uh, macrophages get activated taking signal from the TH cell. And what happening? What are the consequences? Sensitized TH cell releases the cytokines, especially cytokines, and that activate the macrophages or TC cells, which mediated direct cellular damage. And typical manifestation include the contact dermatitis, tuberculosis, or tuberculosis lesions, and graft rejection. Sometimes, especially they have mentioned graft rejection. See, graft rejection and in the graft rejection, delayed type of hypersensitivity play a key role, one of the pathway to reject the graft rejection. Okay, uh, this is one of the pathway. And next is that this second pathway is that MSC expression on the graft tissue will attract the different types of the cells. Okay, for example, uh, CD8 cells. Okay, CD8 cells, especially cytotoxic cells, and this cytotoxic cell get activated and releases some membrane damage enzymes, lytic enzymes. And what is another pathway? And membrane damage. That is about membrane damage. That's another pathway is that complement lysis. Complement lysis. Okay? Whenever the grafted tissue exposed to the recipient tissue, some of the complement protein goes and binds with the graft surface molecule. And this complement binding guides the different types of the uh, uh, attract different types of the cell towards the graft tissue. This is after the complement protein attachment, the force formation and antibody guiding uh, opsonization will be happening. What is the consequence? Finally, graft rejection or tissue damage will be happening. And another pathway is that antibody dependent cell mediated cytotoxicity, as we have discussed earlier. Okay, in this mechanism, natural killer cell get activated by the taking the signal from the FC receptor. Whenever the FC region binds with the FC receptor on the surface of the natural killer cell, after the attachment, this natural killer cell get activated and releases some cytotoxic enzymes or which directly kills the having the capacity to kill the cell. And this is about the different types of mechanism involving in the allograft. Okay? And this is even one of the example kidney uh, graft rejection affect our phase and sensitization phase. What we have clearly discussed in the previous class, previous session. Okay, and what happening in the what doctors are done in the grafting procedure, they are giving immunosuppressive agents. Okay, they will block the exact mechanisms, different types of mechanism. They block the different types of mechanism pathways. Okay, they block the different types of steps, different steps in involving in the pathways. Okay, they block those steps. They block those steps. For example, if you take T cell activation, they will give some suppressive T cell suppressive activation, suppressive ingredients or pharmacologically active medicines, and they go and bind with uh, they block the different types of cytokines. They block the different types of receptors on the surface of the T cell, thereby the activation of the recipient or the grafted T cell, inactivation of the recipient or grafted cells will be T cell will be done. Thereby, the acceptance of the graft is being taking place. Okay, in the process of graft acceptance, they are giving immunosuppressive drugs. Okay, what are they? Okay, they steroid. They sometimes they are giving steroids. Sometimes they are by giving the steroids, they are activation of by antigens. Okay, sometimes they are giving cyclosporin, okay, FK506, and steroids. What exactly these ingredients are acting? These ingredients goes and binds the cytokine synthesis, block the cytokine synthesis from the T cell, okay, thereby the inactivate the T cell. And sometimes they are giving rapamycin. This is a immuno suppressive drug or agent. And what exactly this drug is working? Where exactly this drug is working? This drug is working on the uh, interleukin 2. Okay, thereby the activation of the T cell will be stopped. Okay, sometimes they are giving uh, azathioprine, okay, methotrexate, okay, mesobrine, etc., drug. What they are doing? They are doing DNA. They are stopping the DNA synthesis in the exactly as S phase of the T cell. Okay, different types of stages, cell cycle stages will be blocked. Okay, by using different types of the agents, immunosuppressive agents. This is one of the major uh, technology to reject the to uh, stopping the rejection of the graft. Okay, this is about the immunosuppressive agents. Okay, entire things I have covered in this topic. If you have any doubts, you can ask. No, any doubts, Amma?
Sir, what is meant by CTL? Is it complement lysis?
C
CTL.
CTL, a
Yes, sir.
cytotoxic lymphocyte. Cytotoxic lymphocyte.
Okay, sir. Sir, do we have naturally T suppressor cells in our
Naturally, T
body?
suppressor cell. Yes,
Yes,
yes, we
sir.
have naturally T suppressor cells. In general, we have
In order to accept the graft.
accept the graft, but
Okay,
not
sir.
active. But not every time it actively participate in the graft acceptance. Thereby,
Okay.
that's why they are giving immunosuppressive drugs. The
Yes,
main
sir.
solution for the acceptance of the graft is that
Blood
giving
groups?
the immunosuppressive drug.
Okay.
Mm.
Sometimes if
After
the
the
blood group is matching,
uh, definitely,
then the
definitely,
graft is accepted.
graft will be after the blood group matching is not only the blood group matching, but also different types of cell surface MHC molecule matching will also be taking place. After the MHC
Okay.
molecule matching is also required for the graft acceptance.
Okay, sir.
And there is no antibodies are formed in the previous time for the graft. Okay, that is one also what we have talked earlier. These are the three steps. Okay, should be tested before the graft procedure. Okay, these are the three
Okay,
steps
sir.
are very important. First is that blood group matching is necessary to graft procedure. Before going to graft, we must do these three things. Doctors are must do these things after the confirmation, taking the confirmation by these three tests. They are they go ahead. Okay, what are they?
Sir, your
Blood group
voice is
matching.
not clear, sir.
Voice. Okay, the technically internet problem.
Sir, your voice is not clear.
Now, hello. Now is it clear?
Now,
Hello.
okay.
Hello, sir.
Now, okay,
No,
sir.
Now
sir, still.
uh, sometimes the net problem, internet problem is there. Now is it clear, Amma?
Yes, sir. Yes, sir. Sir,
Uh,
one
but
more time you explain cross matching, sir.
cross matching. Okay, okay. Cross matching means in the first graft rejection, that is first set of rejection. Okay, if the graft in the first time rejection already antibodies are produced or synthesized in the recipient tissue. Okay, This is about cross matching, means first antibody formation in the recipient
Recipient.
tissue. First, after the first grafting, if it is second graft, okay, in the first after the first rejection, they go for the second graft. Patient go for the second
Okay,
graft.
sir.
What they
Okay,
are
sir.
doing? They they do the antibody confirmation. If there is any antibodies are formed for those specific first graft tissue, they confirm antibody formation to the first graft and then go for the second graft. They block the first formed antibodies by the antibodies formed for the first graft.
Okay.
Understand, Amma? First
Yes, sir.
after the first graft, if after the first graft rejection, they go for the second
They,
graft. Okay,
they will see for memory cells, sir.
they seizes the antibodies formed by the first anti graft antigens. Okay, first graft antigens. Uh,
Okay.
Sensitization and antibody formation. After the antibody formation, only the graft first graft will be rejected. That is the general in
Yes, sir.
general phenomena.
Procedure.
They in general procedure, what they do in the second graft, they confirm the whether the antibodies are formed for the first grafted tissue or not. If they
Okay,
are
sir.
formed, they they inject the antibodies for those specialized antibodies. First they
Okay.
block the formed antibodies. If they
Okay,
not
sir.
block the antibodies, they directly encounter on the second graft also.
Yes, sir. Second grafting is also failed.
Before going to second graph, they block the cross check for the antibody
Okay,
for
sir.
the first graph. Okay, then only
Okay, sir.
they go
Understood,
for
sir.
yes, yes. Any
Thank you,
doubts?
sir.
Okay. All these are the mechanisms involved in the graft rejection. Okay, different types of lysis, antibody dependent cytotoxicity, different types of mechanisms are involved. Okay, sensitization phase, effector phase. So what is sensitization phase? In the sensitization phase, the different types of immune cells are get sensitized by recognizing the antigens present on the graft tissue, by taking the signal from the molecules released from the graft. Okay, different types of molecules, different types of antigens get activates the get sensitizes the our recipient uh, cells. Okay, by taking the signal from the graft tissue, uh, releasing molecules, graft tissue exposing the antigens, our recipient immune cells get sensitized. After sensitization, they undergoes the effector phase, effector stage. Okay, if you understand well, uh, today I would like to give brief introduction about hypersensitivity. This is your block third, the block third, uh, and unit 9. That is hypersensitivity. Page number 117. For your reference, page number C for 117. I would like to give brief introduction about this topic, and we will discuss basics of the hypersensitivity today, and we will discuss the different types of hypersensitivity possibly next week or next class. What is hypersensitivity? Do you have any idea about hypersensitivity? Anyone? Hypersensitivity. Any
Some
idea
people are
about?
allergic to some food items,
Uh,
like
Allergy.
chemical substances, allergy, for the food items,
Allergy.
or
They whenever they swallow or swallow the food items, they will get allergies, some allergic reaction after the
yes, sir.
consuming the different types of food material. Okay, very good, very good. But that is one of the hypersensitive reaction. The exactly what happening, the natural process is that immune system play an important role in protecting the host from invading pathogen. This is a natural phenomena. What is the natural phenomena? Our immune system plays or protect the uh, host, our body, from the invading pathogen. By this pathway, and without causing any harm to the our tissue or our cell, our body. What our immune system is doing? Our immune system protecting our body without causing any damage. This is natural phenomena. Is it right?
Yes, sir.
Yes. And sometimes what happening that the effector molecules of the immune response include subclinical and local inflammatory reactions to eliminate the antigens. Uh, the some circumstances, in some circumstances, not always, the not every immunological reaction is leads to the may not leads to the hypersensitive reaction, but sometimes some exceptions times, some circumstances, the inflammatory responses. Okay, every time our body get inflammation, but the inflammation may not lead to the severe damage to our cell. But sometimes the inflammatory response induces adverse reactions and causes the tissue damage, sometimes ever death, even death. Okay, not always our body, our inflammatory reactions or inflammatory responses may not leads to the tissue damage, but sometimes, especially in the situation of the allergic reaction. Okay, these inflammatory responses induces the adverse reactions towards the body or towards the tissue on the tissue surface and may cause the tissue damage. Okay, in general, they without causing the pathogens or parasites get are eliminated from our body. But in this situation, adverse reactions on the infection site will be taking place, and these adverse reactions may lead to the tissue damage at the site of infection, sometimes organ failures, sometimes even death also happening by this hypersensitivity reaction. Okay, hypersensitivity reactions occur at the different times after coming into the contact with the antigen. Okay, they are divided into two types. What are they? Immediate type of responses, and second one is the delayed type of immune responses. The classification of the hypersensitivity is that based upon the uh, response, based upon the time taken to manifest the symptoms. Okay, based upon the time taken to manifest the symptoms, they classified into two types. Okay, two types. In general, I will give the definition for the inflammation and hypersensitivity. What is the main difference between inflammation and uh, hypersensitivity? I will give the definition. Just listen carefully. In generally, these effector molecules induces the localized inflammatory response that eliminates the antigen. Okay, the inflammation reaction is that it eliminates the antigens without extensively damaging the host tissue. It cannot damage the in the inflammatory process. The, our body tissue cannot damage the get damaged. But what happening in the hypersensitive reaction? Under certain circumstances, inflammatory response can have a deleterious effect, resulting in significant tissue damage, even death. The, the main difference between the inflammation and hypersensitivity is that damaging damage is the main difference. In the inflammatory reaction, damage is there, but not more than hypersensitivity. Is the normal damage is there implement in the inflammatory reaction, but adverse or deleterious damage is there in the hypersensitive reaction, also called as allergies. Okay? May develop in the course of either humoral and cell-mediated responses, and symptoms manifest the almost immediately, and a few others they take hours to day. Okay, based upon the time taken to manifest the symptoms. Okay. Based upon the time taking to manifest the symptoms, they have classified two types. Okay, what are they? Immediate type of hypersensitivity reaction, delayed type of hypersensitivity reaction. Okay, first one is that immediate type of hypersensitivity reactions. What is immediate? Symptoms manifest within minute to hours. Okay, in the immediate type of hypersensitivity reaction, symptoms will be occurs after the minute to hour. In within the hour, the symptoms, different types of symptoms, inflammatory, severe inflammatory, damaged inflammatory responses can be seen after with hour to minute to hour. Okay. What happens in the delayed type of hypersensitivity? Symptoms manifest after a few days to weeks. After few days to weeks, symptoms may be manifest after the encounter of the different types of the antigens, and this is one type of the classification. The different types of the, especially two types of classifications is there. One is the based upon the time taking, and second one is that based upon the branch of acquired immunity involved. Okay, one there is two there are two types of classifications for the hypersensitivity reaction is there. One is that based upon the time. Okay, based upon the time taking, two types: immediate type hypersensitivity reaction, delayed type hypersensitivity. This is one type of classification. Coming to the second type of classification, based on the branch of acquired immunity, especially in this hypersensitivity, acquired immunity is very actively involved. Based upon the branch, we have two branches. That is humoral immunity, humoral immunity subtype in the acquired immunity, and second subtype is that cell mediated immunity. What type of immunity branch of the acquired immunity is involving in this type of hypersensitivity reaction? Based upon that, the scientists uh, are classified into the four types. What are they? Type 1 hypersensitivity reaction, type 2 hypersensitivity reaction, type 3 hypersensitivity reaction, type 4 hypersensitivity reactions based upon the acquired immunity involved, whether they whether the cell mediated immunity is involving, or whether humoral immunity is involving in the hypersensitive, making the hypersensitive against the different types of antigens based upon the acquired immunity branch subtype. So they have classified four types. Uh, Coming to the, I am giving the overview about four types, not entire things. I will give entire things. I will explain entire things in the next class. But I am going to give a brief account on four types of hypersensitivity. Hypersensitivity. Coming to the first type, what happening in the first type? In the first type, the type 1 hypersensitivity reaction, and the granulocytes means mast cells, and eosinophils are play a key role in this type of hypersensitive reaction. These are all are allergic reactions. Okay, allergy making reactions. Whenever we get exposed to the spores, sometimes milk, sometimes different types of poisons, toxins, they will get allergic reaction. Okay, milk also one of the make allergy making substance. Okay, product. Okay, the different types of the allergy making products are there. For example, bee venom, um, uh, scorpion venom, uh, snake venom, spores, sometimes grass, sometimes dust particles, sometimes heavy metals. Different types of uh, allergy making compounds are there, molecules are there. What happening whenever these molecules are exposed to our immune system? In the first exposure, they will the sensitization of the mast cell and eosinophils are taking place. Sensitization, especially in the first step, sensitization of the granulocytes are the first step, or is the first step. After this, whenever the our body exposed in the second exposure, in the first exposure, the allergy reaction will be not taking place. Any allergy reactions uh, is not cannot seen in the first exposure. But in the second exposure, what happening? This mast cells and eosinophils are having the receptor for the FC receptor for the antibodies, especially immunoglobulin E. Immunoglobulin E is a major uh, antibody actively involving in the allergy reaction, making reaction. Wherever the allergy reactions are taking place, at that time, the immunoglobulin E is play a key role, is induces the allergic reaction by the activating the mast cell or eosinophils. Mast cell and eosinophils are having receptor for FC receptor for these immunoglobulin E antibody, and this cross uh, link between the two antibodies exactly on the memory cell. Okay, when a memory cell on the memory mast cell or eosinophil cell uh, goes and binds with the allergen. Okay, allergen, and this cross link between the two antibodies activates the mast cell and these eosinophils, and after the activation, in the first exposure they are sensitizing. Then they get sensitized. In the second exposure, they are get activated. They get activated, and the effect on the our body will be seen, can be seen after the second exposure. Immunoglobulin induces the cross-linking of the immunoglobulin E bound to mast cells and basophils with releases of the vasoactive mediator. Okay, after the activation of the mast cell and basophil, degranulation will be can be seen after the activation of the cell. And typical manifestations include systemic anaphylaxis reactions and localized anaphylaxis such as hay fever, asthma, hives, food allergies, and eczema can be seen. I will explain. I will explain entire things in the next class. Don't get bothered about these things. Okay. What is second type of hypersensitivity? The second type of hypersensitivity can also be called as antibody dependent cell mediated cytotoxicity, ADCC. We have also discussed in this type of hypersensitivity in the graft rejection. So this is one of the pathway for the graft rejection. Okay, immunoglobulin G play a key role in this type of hypersensitivity reaction. What is what is the function of the immunoglobulin G? It goes and binds with the antigens present on the foreign cells or foreign pathogens or parasites, and antibody directed against the cell surface antigens mediates the cell destruction via complement activation or antibody dependent cell mediated cytotoxicity. And this anti complement the complement proteins also goes and binds with the antibodies. Okay, and one another pathway is that FC receptors are there uh, on the different types of neutrophils, natural killer cells, eosinophils, mast cells, macrophages. They are being attracted towards the infected site, where exactly antibody antigen complexes are there, which we have discussed in the uh, graft rejection. After infiltration of the different types of the cells, they get attached to the FC receptor on the affected cell complex, antigen antibody complex, and they get sensitized and get activated. The consequences are that damaging of the entire tissue, effector tissue, whether they whether they may be tissue or organ, uh, those entire things will be uh, damaged after the sensitization or effector fails. And third type of hypersensitive reaction in this type, immune complexes. Okay, and all these types, uh, I can say the first, second, third. hypersensitivity reactions, uh, very especially antibody based. The antibody based or immoral immunity branch of subtype. Okay, they especially antibodies are involving in these three types of hypersensitivity reaction. Without antibody, these three hypersensitivity reactions are not taking place. Okay. Means exactly humoral branch of the acquired immunity is being a play a key role in this type of three types of hypersensitivity reaction. So one, two, three hypersensitivity reactions are humoral immunity branch of reaction. Okay. Coming to the fourth type of reaction, I will explain what exactly is type 3 briefly. Immune complexes mediated hypersensitivity. Okay, whenever the antibodies goes and binds with the target tissue, these C3b molecules are having the receptor for the those antibodies and goes binds with the antibodies, and this may leads to the absonization and attraction, chemo attraction of the different types of the cells. That means infiltration, extra radiation of the different types of inactive or now immune cells. For example, if the neutrophil uh, get attracted towards the infected site and it destructs the entire thing and may lead to the hypersensitivity reaction 3. This is how the immune complexes. It takes place by the immune complex, antibody antigen complexes. Okay, antigen antibody complexes. Sorry. And coming to the fourth type of hypersensitive reaction, we can also call it as delayed type of hypersensitivity, DTH, delayed type of hypersensitivity reaction. Okay. I will give examples. Uh, I will explain entire things one by one after the in the next session by giving certain examples. Okay, I will explain in detail. I am just giving the brief about four hypersensitive reactions. Coming to the fourth reaction, this is comes under cell-mediated branch of the immunity, which is one of the branch of the acquired immunity. In what happening in this, no antibodies are involving in this type of reaction, hypersensitive reactions. Without antibody, that the fourth type of hypersensitivity is taking place. That means cell-mediated immunity. So cell-mediated immunity is one of the playing a key role in making it in the hypersensitive reaction 4. And what happening in this type of reaction? Sensitized Th cell play a key role to make the hypersensitive fourth reaction. If the we have discussed in the previous class uh, reaction, graft rejection. What happening after the sensitization phase? Sensitized Th cell get activated and proliferated into the memory cell and Th cell, effector cell. The effector cell goes and binds with the three different cells. One is that cytotoxic T cell, CTL. Another one is that B lymphocyte. Another one is that macrophage. And the binding between these three cells make a different types of uh, hyper, hypersensitive reactions. May lead to the destructive and deleterious effect on the target tissue. Okay? Typical manifestation include contact dermatitis, tubercular regions, and graft rejections also taking place by this fourth type of hypersensitivity reaction. Okay, just I have given brief about four types of hypersensitivity reaction. If you have any doubts, you can ask no. In hypersensitivity reaction, introduction class. Any doubts, Amma?
No, sir. No, sir.
All these things are we have learned earlier. Yeah. Hyperhumoral type of immunity, humoral branch with the help of antibodies, and cell-mediated immunity with the help of Th cell, Tc cell, B cell. We have learned earlier. So this is not a complement thing, a complex thing. Okay? This is not a new thing to us who have presented in the offline class. You have learned about humoral immunity and cell-mediated immunity. This is a new thing to those people, students. Okay. Up to this, if you have any doubts, you can ask. No. Any doubts, Amma?
Sir, in the next class, you'll explain all this again, sir. Means like T3, T4,
Again,
you said. Now you will brief.
By taking examples, okay, hypersensitivity reaction, it will take one and a half hour. Entire
Okay,
next
so
class.
next time, in next class, you're going to explain again this hypersensitivity.
Hypersensitivity reaction. In the end of the session, I will introduce one more topic.
Okay, sir. Right, sir.
Okay, especially autoimmune disorder or diseases.
Okay, sir.
Either vaccinology or autoimmune disease, I will introduce at the end of the session after discussing about the four types of hypersensitivity reactions. I will introduce little bit about topic
Vaccination.
Vaccination or autoimmune disorder.
Vaccination or autoimmune disorder. Okay, sir.
Okay. Okay. Any doubts? You can ask up to first first block 1, block 2. Okay. You can ask anything.
Actually, I have joined from middle, sir. So I was
Just
not
learn.
up to the mark.
Just
Yeah.
go through humoral immunity and cell-mediated immunity.
Okay,
You
sir.
can understand entire thing. Okay.
Okay, sir.
Just read about innate immunity. What is exactly innate immunity? What are the cells
Okay,
are
sir.
involved in the innate immunity? What exactly they are doing? And what is humoral immunity exactly? And what is cell-mediated immunity? Study entire things about these three things: innate immunity,
Okay,
humoral
immoral
immunity,
immunity. What is the other one, sir?
cell-mediated immunity.
Cell
Cell-mediated.
mediated.
Cell chapter unit 6 and unit 7.
Okay.
You can understand everything in immunology.
Okay, sir.
After studying these two topics, you can understanding everything. You can understand
Okay,
everything.
sir. Right, sir.
Because
Thank you, sir.
repeatedly they are coming. Repeatedly they will come in the hypersensitivity reactions, in the complement reaction, in the vaccinology also they will come. Transplantation by immunology they will come. Tumor immunology they will come. Without understanding the innate immunity and acquired immunity or humoral and cell-mediated immunity, you cannot understand anything in the immunology.
Okay, sir.
So just read about these things.
Right, sir. Thank you, sir.
Okay. Any doubts? If you have any no doubts, I will leave the meeting. Can I leave?
Okay, sir.
Sir, thank you.
Okay.
Thank you, sir.
All the best. All the best.
Thank you, sir.